Okay, go.
Hi, this is Sue Olson. This is week 5 video on cognitive behavioral therapy. The first role play is going to be on cognitive restructuring. And this is my client, Jen, who is the same girl that was in the video last week. And we're going to start off with cognitive restructuring. That'll be the first role play that we'll do. And, all right, hi Jen. Thanks for volunteering to do this again this week. For cognitive restructuring, we're going to take one of the issues that you were telling me about in our previous sessions, and which was you had a bit of a problem that led into a bigger issue, right? When you were at Holy Cross, you told me?
Yes.
Why don't you explain to me a little bit about what you were feeling and when it started?
So before I went to Holy Cross, I had always been a dancer, as I told you before. So I was always in front of a mirror, and I was in cheerleading, and all of that kind of seemed to be centered around self-image and how others perceived you. And so when I got to Holy Cross, I started cheerleading again, and there were all these pretty girls around me, and I didn't feel like I was adequate, and so blah blah blah. I felt that way for a while, and then I went abroad, and so I dealt with some of the other issues we talked about. Right. And when I got back, I wasn't really happy with myself, and so I think that some of those feelings resurfaced from before, and I started making myself sick because I felt I needed to be skinnier, and yeah.
Okay, and I mean, were there other factors, like I think you were mentioning that you had met a boy over, I mean, did that play into the scene at all, or,
Not really. I felt that he really appreciated who I was, and I never felt, insecure around him.
You didn't feel insecure, so you never questioned yourself?
Not really, well, I gained a lot of weight when I went to France, and so I think that's what triggered it when I got back. I was back with all, the really skinny, pretty people, and so I felt inadequate.
Right. Well, how did you feel, like, when you were sitting in your classrooms, like...
It wasn't really in the classrooms. I didn't focus on it so much. It was more when I got back to my room or on the weekends.
Right. Okay, so something that I want to try with you, I mean, I know that, you've had these issues, and what were like you told me some of the thoughts that you were feeling at that time. You felt inadequate. Mm-hmm. You didn't feel as if you were...
I just felt fat. I didn't feel pretty enough.
Right. And do you think that's true?
Now, no.
Do you think those thoughts were true?
At the time, I did.
Right. Part of this therapy, is looking at those thoughts that you have, which are pretty irrational thoughts. I mean, you told me you were a good student. You had a lot of friends.
Yeah, I mean, looking back, I can see that I did measure up to everyone else, but at the time, that's how I felt.
Right, right.
Mm-hmm.
And none of this plays a part in your life anymore.
I mean, sometimes. I always seem to be focused on how I look. I don't think that will ever go away, but I have times where, I deal with it in different ways or whatever. Well, but I learned that making myself sick wasn't the best way.
Right. Now, I know you were seeing another doctor before me. What did he do? Like, you were in therapy with him at the time for this. What kind of things did he have you do? Was there any...
I was more talking about my feelings, looking at the mirror, and just more self-affirmational thoughts as opposed to self-defeating thoughts.
Right.
So there's a lot of that. And plus I went on antidepressants, so that helped me a lot, I think.
So do you continue today? with the self-affirmation, you know.
On some days.
Some days. You know, this is something that you really should practice. And try and practice on a daily basis. You know, when you start to get those irrational thoughts, you know, we all have different bodies. You know what I mean? And, you know, you're a bright girl. You just got accepted into a PA program. You know, you're very independent. You do well for yourself. And these are the things that I know it doesn't take away from looking in a mirror. But, I mean, you know, you just got to learn to tell yourself that that's just irrational.
Mm-hmm.
You know, what's true is I'm a hard worker. You know what I mean? I'm a good student, you know, and, you know, also another part to this that I'd been looking at was relaxation techniques. You know, they also, from what I learned is, you know, when you're in that bad thought area in your brain, something that I've learned is to go over to the other side of your brain where play some music, you know, get on your headphones and you know what I mean, try and get out of that zone. Could you expand on anything else that maybe you do now to help yourself with that, or, you know,
I think a lot of it too is just that I've grown up a lot, and so my ways of thinking are different. I feel more of a woman than just, you know, a college student comparing myself to others. So I know there's more to life than that.
Right. That's a good way to look at it too.
Or I redirect my focus.
Right. Well, that's good. I thank you for sharing that. I know it's a personal issue with you and it's very difficult to talk about.
Mm-hmm.
But, you know, in a way, between talking with me and then self-talking, you know what I mean? Both of them, I think, are a positive.
I think so.
Yeah, good. All right, and then another part that I wanted to, another thing that I had come across, and you were telling me about another one of your issues that you were having. And I know these are like past issues, so it's kind of hard to put yourself back there when you've already worked on, you know, some of this stuff. But I know recently you said that you had a problem with sleeping. The next section is paradoxical interventions, which is more of, instead of telling a client to do something, what you would do, well, I'll do this role play and then you can see how this works. So you were having a problem with sleeping?
Yes.
Okay. Can you tell me exactly, maybe a little bit about what you did? Because I know it went on for quite a stretch to maybe help yourself.
So when I couldn't get to sleep, that I always hear to, you know, get out of bed if you can't fall asleep. And my problem was centered around falling asleep for about 2 weeks or so. I would fall asleep, but it would be like late in the night or early morning, I should say, like 5 a.m. So at first I would just toss and turn, and it was just really miserable. And then I remember that they said to get out of bed and go try and do something, so I would try and read, or I would try and listen to calming music, or try and meditate to try and get myself to sleep, but none of it seemed to be working, and so I actually had to go and ask for sleeping medication to kind of restart my cycle.
Mm-hmm. With paradoxical interventions, this is the kind of intervention where I might tell you it works opposite. If the client's having problems sleeping, you know, I wouldn't tell you to relax or take a shower. What I would do is tell you to try, okay, I don't want you to sleep. I want you, what you did, but on your own, but I would tell you not to go to sleep. And the way it would work is, it would work opposite, and hopefully it would get you to sleep by you trying to stay awake.
Like reverse psychology.
Right, exactly.
Do you think I should try that?
The next time it happens, yeah, I would, just say, okay, I'm not going to go to sleep, get up and, I don't know, it's hard too because sometimes you stimulate yourself when you try and do something else. But I think that something else may be like maybe reading a book, something that's soothing, I would stay away from being on a computer because that can have a tendency with a lot of people to get them hyped up. Limit your coffee intake, caffeine. I would personally, as a counselor, use medication as a last resort. Even with the medications, I mean, there's other things that are on the market that, you could use because a lot of them tend to be addictive. You know what I mean? You don't want to get your body used to that. You want it to naturally, its own cycle. So that's this week, week 5, Cognitive Restructuring and Paradoxical Interventions by Susan Olson. Thank you.
Thank you.